I know you're wondering why I brought you here. I got told that yesterday you weren't really confident with oxygens, and I don't blame you.
Yara, do you know why patients sometimes need oxygen? Because their oxygen levels are low? Exactly, but oxygen isn't just oxygen. Different children need different amounts and different devices.
These are nasal prongs or nasal cannula. We usually use them when a child needs a small amount of oxygen and can tolerate having something on their face. So they're often the first thing we try?
What if they're still struggling? Then we may need a face mask depending on what the medical team decides. So this delivers more oxygen, they need more support.
And it is called a rebreather because the patient rebreathes some of the air they have just breathed out. When you breathe out, the first part of your exhale breath comes from your airways. This air still contains quite a lot of oxygen.
And what about that mask with the bag attached?
That's a non-rebreather mask. The one used when they're really unwell? A non-rebreather mask has that big bag attached to it because the bag acts as a reservoir of oxygen. Think of it like a storage tank. When oxygen flows into the mask, it fills the bag with oxygen. Normally, when we breathe out, we exhale carbon dioxide. That helps stop the patient from breathing in their exhaled air again. So fresh oxygen comes in, oxygen is stored in the bag, and exhaled air leaves through the side valves.
Yes, it can deliver a much higher concentration of oxygen and is often used in emergencies while we wait for medical review.
That sounds scary.
It can be, but that's why we learn these things. Remember, we don't just look at the oxygen number.
Are they working hard to breathe? Are they alert? What's their color like? What are their observations telling us? So it's not just about one number. Never.
There's so much to learn.
There is. But 6 months ago, you didn't know how to do a full set of observations.
Now you're recognizing oxygen devices and understanding why they're used.
I guess that's true, all thanks to you.
You're doing better than you think. One day I'll be teaching students this. That's exactly the attitude I like to hear.